Bismillahirrahmanirrahim. Assalamu alaikum. Welcome to the discussion on multiple choice questions. Today's topic is technique for open extraction of multi-rooted teeth. After the extraction of a maxillary second molar, a larger portion of the tooth root is left behind. The oral surgeon decides to use a small straight elevator to address this. What is the correct technique for using a small straight elevator to displace a remaining tooth root? This can lead to displacement into undesirable area. It ensures controlled displacement without excessive force. In this figure, when a larger portion of the tooth root is left behind after extraction of tooth, the small straight elevator can sometimes be used as a wedge to displace the tooth in the occlusal direction. It must be remembered that the pressure applied in such a fashion should be in gentle to and fro motion. Excessive pressure should not be applied. Excessive pressure should be avoided. Not recommended for this procedure. Does not apply to the desired technique. So the correct answer is B. The small straight elevator should be used with gentle to and fro motions to displace the tooth root occlusally without applying excessive pressure. A surgeon is cautioned about the potential risk when using excessive pressure with a small straight elevator during a tooth root extraction. What is the potential consequence of applying excessive apical pressure with a small straight elevator? Excessive pressure does not guarantee efficiency, not directly related to the pressure applied. Excessive apical pressure can cause excessive pressure in the apical direction results in displacement of the tooth root into the undesirable places, in such cases the maxillary sinus. Not the primary risk mentioned, less likely to compare to the displacement of the root. So the correct answer is C. Applying excessive pressure in the apical direction can result in the tooth root being displaced into the maxillary sinus. During the open extraction of a multi-rooted tooth, such as mandibular molar with an intact crown, what is the initial step for facilitating the removal of roots? Important for access, but not the first step in extraction process. Not the initial step. Sectioning is prioritized for strategic removal. Correct method for dividing the tooth into a manageable section. In this figure, if the lower molar is difficult to extract, it can be sectioned into a single rooted teeth. The envelope flap is being reflected here, and a small amount of the crystal bone is removed to expose the bifurcation. Drill is then used to section the tooth into the mesial half and a distal half. Lower universal forceps are used to remove the crown and root portions separately. So each portion of the crown and root is removed separately, that is the mesial and the distal portion. Used later in the process to remove individual roots, used after sectioning and mobilization. So the correct answer is C. The tooth is sectioned buccolingually to divide it into a mesial half and a distal half, making it easier to remove the roots. A 35-year-old patient is undergoing the removal of a mandibular first molar with a missing crown. The oral surgeon decides to section the roots to facilitate removal. Which instrument is commonly used to section the roots in this procedure? Used for smoothing bone, not sectioning. Used to grasp and remove roots or crown, not for sectioning. The surgical handpiece with a number 8 round burr or Fisher burr used to section tooth into mesial and distal parts allowing each root to be independently removed. Here we will explain in this figure. The lower molar has roots that make it necessary to section the tooth. The flap is raised to expose and allow sectioning. Note the small releasing incision that is on the mesial side, and this is on the distal sides of the tooth. The surgical handpiece with a Fisher bar used to section tooth into mesial and distal parts, allowing each root to independently be removed. Tooth sectioning is usually accomplished with a straight handpiece with a straight bar, such as number 8 round bar, or with a Fisher bar, such as number 557 or number 703 bar, under copious irrigation. The straight elevator is then inserted into the bar cut to complete the division of the crown. Each root can now be elevated and removed. The completed procedure you can see here with a chromic suture closing the distal releasing incision. Used for delicate removal of root tips, not sectioning. Used for luxating and mobilizing roots, not for sectioning. So the correct answer is C. A number 8 round bar is typically used under copious irrigation to section the roots. Tooth sectioning is usually accomplished with a straight handpiece with a straight bar, such as number 8 round bar, or with a Fisher bar under copious irrigation. An oral surgeon is performing an extraction of a maxillary molar with widely divergent roots that require sectioning. Which step should be performed to avoid fracturing the palatal root? Increases risk of fracturing the palatal root. Method to avoid undue stress on palatal root. In this figure, the upper molar forceps are used to remove the crown portion of the tooth along with the palatal root. Before this extraction of the palatal root along with the crown, the tooth was sectioned into the 3 portions. That is 2 buccal roots, and 1 is the palatal root along with the crown. So the tooth is delivered in the bucco-occlusal direction in this way, occlusal as well as the buccal side. You will remove the tooth, remove the crown, and force it towards the buccal side. So the tooth is delivered in the bucco-occlusal direction, and no palatal pressure is applied on the palatal. Pressure is applied, it would probably cause the fracture of the palatal root from the crown portion. Usually follows initial sectioning and crown removal. Not a common practice and might complicate the extraction, can risk damage to the maxillary sinus. So the correct answer is B. The entire delivery force should be in the buccal direction to avoid fracturing the palatal root. Thank you. Wish you best of luck.